Today's reported deaths, a child 9 years old or younger. Health officials are not releasing any other information about the child, but they say it is the first time somebody that young has died from COVID in Maryland. It is a sobering reminder for parents about the potential dangers of the virus. Keith Daniels spoke with a mother whose family experienced their own coronavirus scare.
Well, one of the things you're told to do is stay at home, quarantine if you suspect that you've been exposed to COVID-19. Now, the threat of the disease isolated one Baltimore County family, and tonight, the mother said she feared the worst for her little boy. Kate Blizzard is a mother that knows what it feels like when COVID-19 hits home. The invasion threatened her son's health. 10-year-old Nolan.
I scrambled to get him a COVID test.
Chaos over COVID after learning her husband tested positive for the virus a week ago, possibly exposed at work. He's doing well, then concern for his wife and child.
I was definitely worried, and I was watching him very closely just to make sure that he wasn't having any symptoms.
According to the Maryland Department of Health, 3 children between the ages of 10 and 19 have died of COVID-19 in Maryland. Now officials report the first death of a child under the age of 10. Dr. Kristen Brown is a pediatric acute care nurse practitioner and assistant professor at Johns Hopkins School of Nursing. Dr. Brown believes there could be more cases of children with COVID.
We know that children under 2 are more vulnerable. We know that children with comorbidities such as asthma, obesity are at higher risks.
Blizzard says her son has no compromising conditions, and this past Saturday, they got the results of his COVID test. Negative. Well, good news for that family. Meantime, state health officials say Baltimore County has the highest number of coronavirus cases in the Baltimore region with more than 29,000 cases.
Pushing forward with the next critical step in a COVID-19 vaccine.
Yeah, tonight Moderna now has filed for emergency approval of the possible vaccine it developed with the University of Maryland. And as ABC7 Maryland Bureau Chief Brad Bell explains new at 6 o'clock, that is shifting the focus now to ensuring that people will actually roll up their sleeve and get this shot.
As pharmaceutical maker Moderna announces its COVID vaccine 94% effective at preventing COVID and 100% effective preventing serious illness, and formally asks for FDA approval, one of the vaccine trial's lead investigators said she believes the drug to be effective and safe.
What we know now is that 30,000 people have gotten the vaccine, and at least half of them have been followed for several months. And there are no major safety signals. That's pretty powerful.
Dr. Karen Kotloff of the University of Maryland School of Medicine understands that polls show 40% of those asked have doubts about vaccines. She says as it rolls out in the weeks ahead, you can trust the science.
There is zero chance that you could catch COVID from these vaccines. If you have a 94% chance of being protected and a close to 0% chance of not getting severe disease, would you rather have that, or would you rather take what you can get from social distancing and wearing a mask?
Dr. Boris Lushniak, Dean of the University of Maryland School of Public Health, says having a large majority of the population vaccinated is the best way to end the pandemic.
You can easily get herd immunity by everybody getting the disease, but the repercussions of that are what? A lot of people dying and a lot of people getting really, really sick. So the easiest way of getting herd immunity is getting a vaccine that works.
Live now, joining you at the Prince George's Hospital Center in Cheverly. The first doses of the vaccine are expected to be given by the end of December, and they're likely to go to first-line healthcare providers like those who work here at this hospital. There's expected to be little resistance. But in the months after that, as it rolls out into the general public, you can expect to be hearing an awful lot about this hesitancy to get the vaccine, and from these healthcare providers who say it is absolutely safe. It has been proven. Next step for this vaccine, FDA approval. If all goes well, that could happen in just a matter of a couple of weeks. In Cheverly, Brad Bell, ABC7 News.
Let's take you through those next steps, Brad. The FDA will meet to consider Pfizer's vaccine late next week and Moderna the next week after that. That could have the first doses going out within 2 weeks. Now, before the first shipments roll, though, the CDC will meet tomorrow to finalize who gets top priority. That's because initially there's only believed to be about 3 million doses available. Today, DC's health director said they're expecting about 8,000 doses at first. That's only enough, though, for 10% of its highest priority group, frontline healthcare workers.
Help close the opportunity gap among its students. Mackenzie Frost is live for us now to break down how COVID-19 could be impacting children's learning. Mackenzie.
Hey, Mary, I spoke with a mom today of 3 students in Anne Arundel County Public Schools, and she says that her kids have Chromebooks issued by the public schools, and sometimes they don't work the way they should, and she's worried that her students are falling behind. School from home has been a reality for several months now. Stephanie Hubbard has 3 kids, all trying to figure out how to learn virtually.
It's all almost a Band-Aid fix, but they're not getting what they should be so they can be successful.
This report, set to be discussed Monday evening, outlines the opportunity gaps between students in Anne Arundel County. The disparities are magnified by COVID-19. The report says low-income families have been hit hardest by the pandemic, making at-home learning even more challenging. An uphill battle Stephanie and her kids are facing now.
And the only computer we have in the house is my old MacBook, and it's not even the best quality right now. It turns off on my daughter, but we don't have the funds to go out and spend money on brand new computers.
Opportunity gaps are worse for Black students in the county. The report shows 34% of African American kindergarten students in 2019 were ready for school, while 55% of white students were. The data shows the gap widens as students go through school. COVID-19 impacting more students than those already at a disadvantage. The Brookings Institute shows a learning loss across grade levels and subjects. From reading to math, students could see a bigger learning loss than usual summer slides. Back in the Hubbard house,
They would be doing a lot better.
Stephanie says her once engaged 6th grader is slipping.
She was almost honor roll student, like all A's and B's when they were actually going to school. This year, we just got emails that she's almost failing classes.
And at the very least, would like to see her kids in class a few days a week so they don't fall behind even further. Now, we'll stream that Anne Arundel County meeting on our Facebook page, and if you want to see that entire opportunity gap report, I put it in this story on our website. It's there right now. Just head to foxbaltimore.com.